In this video, I'm going to talk to you about why therapeutic support is often the key to lasting voice change. Not least for voice feminization, because it's a slightly longer process. And as you can imagine, when you're changing your voice from one thing to another, lots of emotions come up at the same time. Now, sometimes practicing with little bits of advice from clips here and there, or trying things yourself, sometimes works for people, but very often it doesn't, because it really needs some guided support. The emotional side of voice change is really neglected in most cases. And this is because voice is a social phenomenon. We use our voice to talk, usually with somebody else, and usually when we're out and about in so many different settings, for work, with friends, with family, and all those contexts bring emotions with them. Of course, it's also identity, so that brings a certain amount of concern and self-consciousness sometimes, especially when identities are evolving. So having somebody walk the journey with you is why often therapy is successful for people. The battle really is to work out whether you have the patience to go through it or a little bit of time to go through it, because it's not an instant fix. No therapy is an instant fix. Voice therapy has the advantage of being quicker than many other types of therapy. Psychotherapy, for example, or counselling often goes on for years. But voice therapy isn't like that. It does end, and depending on how many sessions you have, say 2 a month, could take a year to change a voice. It really depends on the person. I've said it before and I'll say it now, that some people take to it very quickly and do really well in a few sessions. Some people need longer, and that's just how human beings are. But if they're keen to change, the benefits they get from being supported through a voice change process are often long-lasting, in fact, a lifetime worth of benefit. All the self-consciousness that people feel when they're changing their voice is very natural, but it's actually the biggest thing that people need to work against, or work with and work through. And of course, the therapist guides them through that process. So for example, if you're learning to do something new, like riding a horse or exercising in a different way, and you haven't done it before, it's going to bring up feelings of self-consciousness for most people. Most people are not just super confident in everything new they try. So changing a voice makes people feel self-conscious often, and that can sometimes derail them from just keeping on the practice or keeping on the journey. But by having support and someone telling you what's normal for this stage and how this is a general way people feel, or giving you the confidence to feel the fear and try it anyway, of course that will make crucial difference to people. And if they can just get through those self-doubts, the voice change almost happens just effortlessly. But it just needs a little support for most people. Left to our own devices, many of us would give up, and that's very true for voice. But of course the person doesn't have an understanding of voice, or what they can do to make it better or make it work. But that's where the therapist comes in. They do have that knowledge and they do have that skill, because whilst it's not as quick or seemingly as quick as perhaps a surgery, voice therapy brings lasting results, and also the emotional support that helps somebody overcome fears and doubts. Of course, sometimes surgery will fix a pitch quicker, especially if that's the person's goal. But if you think about the voice recovery time post-surgery, which is at least 4 weeks and sometimes 6 for the hoarseness to sufficiently go away, then that's added time. And pre-surgery, there should also be some therapy input, so that's also time. In some cases where the surgery doesn't quite go to plan, then there's a whole load of therapy. And that's why I feel trying therapy and going through that first gives you the best chance of voice change happening, perhaps successfully, without any need for surgery. And if the person still wants to proceed to surgery, then they are actually in the best position to do so. If you found this video helpful, press the like button and subscribe to the channel.